Good morning, my name is Tu and I'm a student from Texas Women's University. Today I will be giving you insulin, and this procedure should take about 15 minutes. But first let me go ahead and verify your name and date of birth according to your wristband. Jen Winthrop, February 10th, 1942. No known drug allergies. Thank you, Mr. Winthrop. I have now verified that Mr. Winthrop does not have any allergies, especially to latex. And now I will check the patient's blood glucose levels at 6:30 in the morning, and the patient's blood glucose level is 155. I'm now going to verify that this is the correct medication ordered in the MAR, and I will also document and check that this is the right medication. I have now checked in the MAR that this is the correct medication to be administered to the patient, and also since her blood glucose level is 155, I need to inject 4 units of insulin. I'm going to perform hand hygiene again. And I'm going to gather my supplies for my subcutaneous injection. So first, I have my alcohol pad. And then I have my insulin vial, regular insulin. And then I have my subcutaneous injection needle. First, I'm going to clean the top of the regular insulin vial with an alcohol pad. Next, I'm going to open the package with the needle. And making sure that I do not touch the needle, I'm going to remove the cap like this. And according to the sliding scale in the MAR, the patient needs 4 units of insulin. So first, I am going to inject the correct amount of air into the syringe, which is 4 units of air first. I now have 4 units of air injected into the syringe. I'm now going to be putting the needle through the rubber top . And now I am going to eject the 4 units of air from the syringe into the vial. I'm now going to turn the vial upside down and fill the syringe back up with 4 units of insulin this time. Now that I have injected 4 units of insulin into the syringe, I'm now going to remove any air bubbles that are present. Now that I have removed all air bubbles from the needle, I'm now going to recap the needle using the one-handed scoop method. I'm now going to verify that everything is correct using the 6 rights to make sure that everything is checked before administration. So first is the right patient. Here I do have the right patient, Gwen Winthrop, and the date of birth is February 10th of 1942, and he does not have any drug allergies. I will also check this step in the 6 rights process by scanning the wristband into the MAR to also verify that this is the correct patient. Next, I will make sure that I have the right drug. Here, the doctor ordered for regular insulin to be administered, and the drug that I have pulled is regular insulin. Next, I am going to make sure that I have the right dose. According to the sliding scale, Mr. Winthrop's blood sugar level that was checked at 6:30 this morning is 155, which will equal to 4 units for the insulin dose that needs to be given to Mr. Winthrop. Next, I will make sure that this is correct according to my needle. And here I have checked that I have 4 units of insulin in my needle to be administered. I will now make sure that I have the correct route to be administered to the patient. Here I have regular insulin to be injected subcutaneously, and I have now checked that this is the correct route. Next, I will make sure I administer the insulin at the correct time. And here, the doctor ordered for regular insulin to be injected subcutaneously at 7:30 in the morning. Note, the blood glucose level is checked at 6:30 in the morning, which I did do so. Now, at 7:30 in the morning, I will be giving his insulin. The last step of the 6 rights is to make sure that I have the right documentation of everything, and to make sure that I triple check everything while checking out the drug from the MAR, checking outside the patient's room, and checking before administering the drug to the patient. Welcome back, Mr. Winthrop. I have gathered all my supplies and I am ready to administer your insulin. But before I do that, can I verify your name and date of birth, and if you have any allergies, including to latex, so that way I can scan your wristband into my record. Gwen Winthrop, February 10th, 1942. No known drug allergies. Thank you, Mr. Winthrop. I will now perform hand hygiene again and put on some clean gloves. I'm now going to use a new alcohol pad to clean the subcutaneous injection site, and I am going to make sure that I start from the center and clean outward. Now that I have cleaned the desired subcutaneous injection site, I am now going to remove the needle cap. Like so. And now I'm going to announce that I am preparing to inject insulin into the subcutaneous site. Mr. Winthrop, I'm now going to inject insulin into your subcutaneous site. Because this is a subcutaneous injection, I want to make sure that I inject at a 45-degree angle. After injection, I want to ensure that I activate the safety cap and place it in the sharps container. I am now going to apply pressure at the injection site if needed with an alcohol pad. Now that I have applied pressure to the injection site, I'm now going to remove my gloves and discard it in the trash. I will perform hand hygiene again after finishing the administration. And I'm going to make sure that the patient is comfortable by performing the 5 Ps. Mr. Winthrop, are you feeling any pain after the insulin administration? The patient is not experiencing any pain. Mr. Winthrop, do you need to go to the restroom before I leave? Patient does not need to go to the restroom at this moment. I'm now going to make sure that all plugins are loose and tangle-free and not caught in any space. Now that I checked that all plugins are loose and tangle-free, I'm now going to make sure that all personal belongings are within reach, as well as the call light within reach, so that way the patient can call if they need anything. Lastly, I will lower the bed to the lowest position, as well as raise the bedside rails up. And now I'm going to thank my patient for his time. Thank you, Mr. Winthrop, for allowing me to administer insulin to you. If you need anything, the call light is within your reach, and just call us if you need anything. Again, I thank you for your time.